What are you doing?
Smoking?
Aha! Don't you know that it's bad for your health?
Yeah.
And don't you know that it's really hard to stop smoking? Give me that! This? Why are you smoking this?
Was it school?
It's really hard to stop, you know.
Well, tell me the benefits of stop. If I stop smoking then.
Within 20 minutes, your blood pressure, pulse rate, and temperature of your hands and feet have returned to normal. Within 8 hours, remaining nicotine in your bloodstream has fallen to 6.25% of normal peak daily levels, a 93.75% reduction. Within 12 hours, your blood oxygen level has increased to normal and carbon monoxide levels have dropped to normal. Within 24 hours from your last cigarette, anxiety levels have peaked in intensity and within 2 weeks should return to near cessation levels. In the next 48 hours, damaged nerve endings have started to regrow and your sense of smell and taste are beginning to return back to normal. Cessation anger and irritability will have peaked.
Within 72 hours from your last cigarette intake, your entire body will test 100% nicotine-free and over 90% of all nicotine metabolites. The chemicals it breaks down into will now have passed from your body via your urine. Symptoms of chemical withdrawal have peaked in intensity, including restlessness. The number of cue-induced crave episodes experienced during any quitting day have peaked for the average X user. Long bronchial tubes leading to air sacs or alveoli are beginning to relax in recovering smokers. Breathing is becoming easier and your lung functional abilities are starting to increase. 5 to 8 days later, the average ex-smoker will encounter an average of 3 cue-induced crave episodes per day. Although we may not be average, and although serious cessation time distortion can make minutes feel like hours, it is unlikely that any single episode will last longer than 3 minutes. Keep a clock handy and time them. Within 10 days from your last cigarette intake, the average ex-user is down to encountering less than 2 crave episodes per day, each less than 3 minutes. From 10 days to 2 weeks, recovery has likely progressed to the point where your addiction is no longer doing the talking. Blood circulation in your gums and teeth are now similar to that of a non-user.
Within 2 to 4 weeks, cessation-related anger, anxiety, difficulty concentrating, impatience, insomnia, restlessness, and depression have ended. If still experiencing any of these symptoms, get seen and evaluated by your physician.
21 days later, the number of acetylcholine receptors which were upregulated in response to nicotine's presence in the frontal, parietal, temporal, occipital, basal ganglia, thalamus, brainstem, and cerebellum regions of the brain have now substantially downregulated and receptor binding has returned to levels seen in the brains of non-smokers.
Within 2 weeks to 3 months, your heart attack risk has started to drop. Your lung function is beginning to improve. 2 weeks to 3 months later, your circulation has substantially improved. Walking has become easier. Your chronic cough, if any, has likely disappeared. If not, get seen by a doctor, and sooner if all concerned, as a chronic cough can be sign of a lung cancer. 8 weeks from your last stick of cigarette, insulin resistance in smokers has normalized despite average weight gain of 2.7 kilograms.
Within 1 to 9 months, any smoking-related sinus congestion, fatigue, or shortness of breath has decreased. Cilia have regrown in your lungs, thereby increasing their ability to handle mucus, keep your lungs clean, and reduce infections. Your body's overall energy has increased.
1 year later from your last cigarette, your excess risk of coronary heart disease, heart attack, and stroke has dropped to less than half that of a smoker's.
5 years later, your risk of a subarachnoid hemorrhage has declined to 59% of your risk while still smoking. If a female ex-smoker, your risk of developing diabetes is now that of a non-smoker. Within 5 to 15 years, your risk of stroke has declined to that of a non-smoker. 10 years after you quit smoking, your risk of being diagnosed with lung cancer is between 30% and 50% of that for a continuing smoker. Risk of death from lung cancer has declined by almost half if you were an average smoker or 1 pack per day. Risk of cancer of the mouth, throat, esophagus, and pancreas have declined. Risk of developing diabetes for both men and women is now similar to that of a never smoker.
In 13 years, the average smoker who is able to live to age 75 has 5.8% fewer teeth than of a non-smoker. But by the year 13, after quitting, your risk of smoking-induced tooth loss has declined to that of a never smoker.
And then 15 years, your risk of coronary heart disease is now that of a person who has never smoked. Your risk of pancreatic cancer has declined to that of a never smoker. And finally, 20 years after, female excess risk of death from all smoking-related causes, including lung disease and cancer, has now reduced to that of a never smoker. Risk of pancreatic cancer has declined to that of a never smoker.
Hey, you think you can stop smoking now?
Yes. Yes, I can.
So when will you stop?
Today. This, no more.
Very good.